In this video, I'll be covering the top 10 worst exercises for painful bone-on-bone hip arthritis. Now, this video is an update I did to a video that I did 2 years ago covering 5 exercises that worsen hip arthritis, but since then I've discovered 5 more things that I commonly hear patients are doing, and we've got rationale for all of this, and these are reasons why you shouldn't be doing these exercises. I'm going to give them all to you right now. But before I go into that, I just want to give you a heads up. These exercises are commonly given to patients by healthcare professionals like doctors and physical therapists. But please realize that not all healthcare professionals specialize in helping you heal from hip arthritis to avoid a hip surgery like a joint replacement surgery. Most healthcare professionals are great at helping you get short-term pain relief from hip arthritis using pain medications and pain injections and exercises like you might do in general physical therapy. And of course, surgery is done by surgeons. They go to school for that kind of thing. And physical therapists, they are exercise specialists, but they tend to work with patients that have had a surgery already. So they're used to working with people that are recovering from surgery to get them back to doing normal things. But when it comes to helping them heal from arthritis, like hip arthritis, and avoid a surgery, they tend to not see that, and they're not always 100% certain with how to help this individual. In fact, they'll usually give them the same exercises they give somebody who's had surgery, and if that doesn't work, send them back to the surgeon so they can get the joint replacement done. So just know that when you're seeing one of these healthcare professionals, they're doing the best they can with how they were trained and what they know, and in their experience, what has helped their patients. And they're not trying to do wrong by you. But if you've done any of the exercises on this top 10 list right here and you feel that they've hurt you, the exercises have hurt you, then you need to know that you need to stop doing that exercise. It's probably not good for you. When it comes to healing hip arthritis, there's nothing that should hurt to do. In fact, if it's hurting you, it's making your hip arthritis worse, very likely. The only time that people should experience pain from exercise is if they're recovering from a surgery. That's very normal because you have incisions, you have things that were cut on, you have joints that were replaced, so you're still healing very much from the actual surgical process, so that's going to be painful. In order to heal hip arthritis naturally, it's necessary to fix the root problem. I've got tons of videos that talk about that. You can find a link to them down in the description below. I just want to make sure that you know that I give you ways to improve your hip arthritis here on this YouTube channel. You can go and find them, and I'll tell you more about them by the end of the video. But let's get into the top 10 worst exercises that you shouldn't be doing if you have bone-on-bone hip arthritis, or even if it's not bone-on-bone, this is going to make your hip arthritis worse. The first exercise is standing leg raises. So it looks just like this. Usually stand up, typically holding onto a chair or something that's stable and sturdy, and then you're picking up your leg out to the side like this, or picking it up forward like so. Sometimes people go across their body this way, and then another one is going backwards just like this. Now, the reason why this exercise is not good is because there usually is no training on what muscles to be using. Now, of those 3 directions that I moved my leg in, only one I would say is reasonably okay, but it's often not coached very well, and it's going backwards. Here's what I mean. When you go backwards like this, you should be using the glute muscle, but very often I see people doing the exercise and they're extending their back like this, and they're using their hamstrings and their back muscles and skipping using their glute muscles. If you're not using your glute muscles and you're not going to be addressing the root problem that causes hip osteoarthritis, that means it's a wasteful exercise. Now, going the other way, going outwards to the side, forwards, or across your body, those movements cause you to use muscles that tend to feed into the hip arthritis problem. And so if you're strengthening those muscles on the front of the thigh and the hip flexors, it actually tends to add more compression to the joint, which speeds up the arthritis process and it allows it to progress, leading you to eventually get a hip surgery sooner than you might like. And the second exercise is just a harder version of this one, but it's very commonly done. It's leg lifts. So you might be lying down on your back like this, and then you're picking up your leg straight like this. There's alternative ways to do it where you're picking up your leg sideways like this, or you might be working this leg and you'll move your leg this way and pick up your leg like this or behind like this, and the reason for that one is to work out the inner thigh muscle. And then you might lie on your stomach and pick up your leg this way. Now, same reasoning with the standing exercises. This is probably the better of the three, but if you're not using your glute muscles and you're using your back muscles or in the back of your thigh and you're skipping this muscle in the back of the hip, then it's not going to be good for you. It's going to feed into the problem. And the other three directions, same as a standing exercise. You're using the same muscles that actually add more pressure to the hip joint, so it's not a good exercise to be doing. The third exercise is leg extensions. So this one is done many different ways. Let me show you the most common one. Usually you're on a machine of some sort and you're working out the muscles in the front of your thighs right here. You're picking up your feet and straightening out your knees like this. Now, if you're doing this against a lot of weight, against a lot of resistance, it tends to be very bad for you. You're going to be using your quad muscles in the front of the thighs here, and one of those muscles, the rectus femoris muscle, it actually crosses up past the hip joint. It attaches to your pelvis bone up here, and because it crosses the hip joint, it's technically a hip flexor muscle. That muscle in particular likes to overcompensate for other muscles that aren't doing their job. And because of the position of that muscle and the way that it attaches to everything, it adds a lot of extra compressive forces into the hip joint and can speed up the hip arthritis process. Now, there's lighter versions of how this is done. Sometimes in physical therapy, you might have like a towel or a ball under your knee and you're told to push your leg down right here against the towel or the ball, and that's going to make you use this muscle. Sometimes you're using a TheraBand, like one of those rubber bands, to straighten out your leg against it. Any of these versions that make you use your leg muscles right here on the front are all exercises that tend to speed up the hip arthritis progression. Number 4 is marching. Now, this one is exactly like what it sounds. You're usually sitting in a chair and you're just picking up your legs like this, like you're doing marching. They'll call it seated marches. I have seen people do this in standing as well, where they're holding on to something with balance and then they're marching like so in place. This exercise uses your hip flexors. And when healthcare professionals are giving you this exercise, what they usually have in mind is they're just trying to be exhaustive with working out every muscle around the hip joint. And one of those is the hip flexor muscles. It's a group of muscles on the front of your hip joint that makes your knee come up like this. It flexes the hip. Those muscles, all the muscles in that group, tend to add that extra compressive force to the hip joint and make it grind in a not so good way. It wears the joint down inappropriately. It puts bad forces to the joint. So it doesn't make sense to be doing this marching exercise because it tends to make the hip joint worse. Number 5 is ball squeezes. Now, I don't have a big enough ball, but usually people will have like a bouncy ball that's about this big. I'm just using this one here. I never do this exercise with my patients, so I don't have the equipment to do it. But the idea is you're squeezing the ball between your knees, usually lying down on your back. You put the ball between your knees right here, and you're trying to bring your thighs together and hold it for a few seconds, or maybe just repeatedly opening and closing on the ball. And it's supposed to work out the muscles of the groin here on the inner thigh. The reason why this is not good is because those muscles work along with the thigh muscles. They actually cross the hip joint and they can cause bad forces through the ball and socket joint in the hip joint as well. This is not a good exercise to be doing overall. Now, let me just take a quick side note here. This exercise, the ball squeezes, along with the thigh exercises, and even the standing leg raises and the lying leg raises, don't usually hurt right then and there. They can. Sometimes they do, especially if it's very inflamed or irritated hip arthritis. But what you tend to find is they hurt later. It might actually even feel better to do these exercises up front. You might feel good while you're doing them, but usually later that day, definitely the next day, especially if you're more aggressive with these exercises, like if you're doing them harder, you're doing them with more resistance, you're not resting as much in between, it tends to irritate the cartilage, and cartilage tends to have a delayed pain effect. So you feel the pain hours later, or even 24 hours later, a day later. That's how typically the pain from this is experienced. It's not in the moment right then and there. If you do feel it right then and there, it means that your cartilage is already very inflamed. The next exercise is not technically an exercise because by definition, when I think of exercise, I'm thinking of muscles contracting and elongating or even just holding a contraction. This is more of a stretch, but it's one that definitely makes things worse. So this is a hip twist stretch. People will usually cross their leg over like this, sitting, and then they'll put their elbow on their knee and twist their hip over like so. And they'll do it quite aggressively. And what happens is when you move your knee across your body like that, right here in the groin where the hip joint is, it causes the ball to move against the edge of the socket, and can compress it quite a bit. And that's where usually the arthritis happens, where the bad forces are going through the hip joint. And so it just aggravates it. It just adds insult to injury. You're pressing on an already injured spot. Now, if you're doing this stretch lightly and it's not hurting you, it may actually be okay. What I wouldn't want you to think, though, is that this stretch is going to heal your hip arthritis, because if we're talking about solving the root cause of hip arthritis, the muscle imbalance is what we need to be focusing on, and this stretch is not directly addressing the muscle imbalance. It may help you get some mobility. You may actually feel a little more loose and flexible afterwards if you're stretching lightly and not aggressively. But if you're stretching aggressively, you're actually going to cause your muscles around your hip to tension up. It's probably going to hurt inside your hip joint, and it does not tend to be a productive thing for you to be doing. Number 7 is a hip flexor stretch. Now, also a stretch, not technically an exercise, but it still adds bad compressive forces to the hip joint. Here's what this looks like. You're going to get like so, and then people lean forward to stretch out the front of their hip. Now, lightly, this is actually okay, and there are circumstances where I do tell my patients to do this exercise, or this stretch I should say, but it's for a small part of the recovery process, and it's not done very aggressively at all. What I'm talking about is when people get in this position and they really push into it, they put a big stretch on the front of their hip, and they make this a regular thing that they're doing throughout their treatment for hip arthritis. The reason why I don't think this is a good thing to be doing it that way is because the hip flexors in the front of the hip, they do get short, they do get overused. They compensate a lot for the backside of the hip where usually the weakness is. And so stretching them out does make sense at face value. But here's the problem. When you go to stretch out those hip flexors, because they're already short, they tend to be a shortened muscle because you're using them too much. When you tension them, it's going to add compression to the ball and socket joint. And so if you're stretching aggressively, you're going to be pushing the ball in against the socket too much. And if it hurts afterwards, well, that's why it hurt, because you just overdid it on this stretch. So what I would recommend if you really want to do this stretch is to do it lightly. On a scale of 0 to 10, intensity-wise, I would stick to like 1, 2, not more than a 3 intensity. And you really don't need to stretch for more than a minute or 2. After 2 minutes, you get what's called diminishing returns. So you're not getting that much more benefit for adding more time stretching. But I see people that do this stretch aggressively, they're getting to like an 8, 9, or 10 on intensity. They're getting very aggressive, and then they're doing this for 5 or 10 minutes. And then they're having hip pain later on. That's how they're doing this wrong. The 8th exercise is a sit to stand exercise. In other words, a squat. But everyone in physical therapy calls this sit to stand. So you're sitting down and then you stand up, just like so. And you repeatedly do this, sit to stand. And the idea is to practice getting up out of a chair, because you might have difficulty with that. You might feel stiffness afterwards, or you might feel weak getting up from a chair. You might be using your hands quite a bit, and so you're trying to get your legs to do this. Now, at the beginning of doing this, it tends to be very productive because you're getting used to the motion. You might actually be getting stronger with standing up. But in the long term, the reason why I don't like this exercise is because without proper coaching on which muscle groups to use as you're standing up and sitting down, you're going to default to using the muscles that are already dominant, usually the hip flexors and quad muscles. And you get this false feedback of getting a workout in because you're feeling these muscles work, you're feeling sore, you're feeling tired in these muscles. And so it's feedback to you saying, oh, I'm getting a workout in, I'm doing something good, this is helping my hip joint. And your healthcare professional, your physical therapist, your doctor might agree with you. They might say, great, you're feeling the burn, fantastic. But over time, as you keep going, you're strengthening the wrong muscles. And that's just adding more compression to the hip joint, and you're going to end up with worse hip arthritis later. So this is not a good exercise to be doing unless you've gone through proper training ahead of time to use the right muscles, and you're confident that you're using the right muscles. That's what I teach in my treatment approach. Number 9, this one's going to surprise you. Number 10 is even more surprising. Number 9 is biking, using a stationary bike or an outdoor bike, any kind of bicycle. This one is so commonly done in every physical therapy clinic. I mean, you're almost guaranteed to get on a bicycle, a stationary bike, if you're going into a physical therapy clinic. They'll warm you up on it, they'll cool you down on it, they'll leave you there for 10 minutes, 15 minutes, sometimes longer. And sometimes people have bikes at home too, stationary bikes, and they'll use the bike. And the rationale that they'll give, that healthcare professionals will give patients on this exercise, is that you're lubricating the joint, you're getting lots of movement in it, and it's good for the hip joint. And that is good information. It actually is true. You do lubricate the joint, and high repetitions for a joint, for a cartilage problem, is generally good. The problem comes from what muscles you're using when you're on the bicycle. So if you're not thinking about what muscles you're using, you're probably going to default to using the same muscles that you've been overusing already, the ones that have been compensating, those quad muscles and hip flexors. And think about it. When you get on the bike next time, pay attention to what muscles get tired. And if it's all these in front right here, and not as much on the back over here, especially back here on the glutes, then you're feeding into the problem. And the sneaky thing about this is you're not going to feel it right away, because you're going to feel the benefit of the repeated motion and the lubrication of the joint. But over time, as you cycle more and you do other exercises that feed into the strength of the front of this muscle, then you're going to gradually add more compression to the joint and kind of undo all the benefits that you got of lubricating the joint. Now, I do teach people how to use a bicycle correctly, and it needs to be a glute dominant motion. In other words, when you push down the pedal, you need to feel your glutes tension up on each side. So you need to be alternating glute contractions, and it should correspond with every time you push the pedal down, the glute fires. You're still going to feel your thigh muscles work, but if you can use your glutes more than your thigh muscles, then you're going to be in a better position to help heal your hip arthritis for the long term. All right, number 10 here, this one's a shocker, walking. Walking is one of the worst things you could do for hip arthritis. It's similar to the bike. People say, go walk for exercise, easy thing to do. All you need is a pair of shoes and get out and walk around the block, go on a treadmill. Everybody needs to walk, you need to walk within your home. Here's the problem. If you're not fixing the root muscle imbalance, if you don't have good activity in the right muscles, usually the glutes, then you're going to be walking using the wrong muscles. And what people often find is that when they start a walking program for their hip arthritis, they actually get better at the beginning of it. They say, oh, you know what, I could only do 10 minutes of walking, now I can do 20 minutes of walking. I've progressed to 30 minutes. I'm feeling a lot better. But as they get more intense with the walking and they're requiring their muscles to work harder, those dominant muscles that are causing the extra compression in the hip joint get stronger, because those are the ones you're using more. So you're training those more. And over time, those hip flexors and quad muscles add more compression to the hip joint, and you get worsening hip arthritis. So people hit this wall usually, where they say, you know what, I just can't make it past 25 minutes. I just can't make it past 40 minutes because then my hip starts to hurt. Or they'll start to say this, it may not be, it hurts during the walking, that does happen quite a bit, but they'll say, you know what, I've been walking 30 minutes, that's about my cap, I'm okay. But you know what, the more I've been doing it, I went up from doing it 3 times a week to 4 or 5 times a week. By the end of the day, my hips are killing me and I'm having more pain at night. That's the experience people get when they're getting pain from walking. And it's that false feedback again, like with the bike and like with other exercises like these, where you feel good in the moment, but you're actually making the problem worse in the long run because you're sneakily working out the wrong muscles. Now, if you're looking for guidance on what exactly you should be doing to correct the root problem of hip osteoarthritis, even if it's bone on bone, then I want to invite you to check out our YouTube playlist. It's called the Hip Arthritis Help Playlist. There's a link in the description down below. You can hit that see more button or show more button, and you'll find our description pop up, and you'll see all the links that we have. They've also got a program that walks you through step by step our treatment approach. I've packed it all into 30 videos that you can find where you are in your healing of hip arthritis and know exactly what exercises to be doing, and then know how to change those exercises as you progress through the healing process to get to the point where you're feeling happy and healthy and active again, and you can avoid having hip replacement surgery. It's very possible. We see people do it all the time. It's just a matter of tweaking what you're doing so that you're doing the right thing to help your hip arthritis rather than hurting it. It's called the Hip Arthritis Recovery Program. There's a link for it in the description below, along with that YouTube playlist. Hey, thanks for watching, guys. If you like this video, please give us a thumbs up. Please share this with somebody you think needs to see this. Don't forget to drop a comment, ask questions. Don't be alone in your hip arthritis journey. You can recover naturally without surgery. We'd love to get back to our comments, so don't be afraid to ask. And please subscribe and hit the notification bell if you haven't already, so that you don't miss out on any of the helpful videos that we post each and every week. I'll see you in the next video. Bye-bye.